How's
Building a better Bay Area for a safe and secure future. This is ABC 7 News.
Hi there, this is Kristen Z. Welcome to our daily program called Getting Answers. We're asking experts your question every day at 3 to get answers for you in real time. But first, we want to take you to breaking news. This is in Rodeo. Sky 7 is following several small fires burning along the eastbound side of I-80. So take a look here. You can see the smoke rising from those very dried hills that are burning right now. One hot spot is near homes on California Street. You can see how close they are also to some industrial areas. There are tanks you can see in this shot. We're seeing flames a mile down closer to the Phillips 66 refinery. That's what we apparently are looking at right now. Crews are on the scene. There was a fire earlier too near the Benicio Martinez Bridge that shut down the southbound side. Forward progress, we're told, has been stopped in that fire. But again, some of these fires burning pretty close to home. So we're going to keep an eye on that for you. But our big story to start the week, and certainly this Monday, joining us to talk about the latest COVID trends in California and the Bay Area is UCSF epidemiologist Dr. George Rutherford. Always great to see you. How are you?
Terrific. Thank you. Nice to be back.
Yes. Hope you had a good 4th of July, a safe one. Let's start with our COVID picture. Governor Newsom laid it out for us a few hours ago. It doesn't seem good, but can you start with the Bay Area and then move on to the state and the nation? Quick snapshot.
Sure. Well, there have been about 30,000 cases of COVID reported in the 9-county Bay Area, including Napa, Sonoma, and Solano, but only 609 deaths. Each death is it's not just a statistic, but it gives you an idea. In California, they're closer to 300,000 cases and 6,400 deaths, and nationally, we're at 2.9 million cases and almost 130,000 deaths. I think the Bay Area has an upward trend in cases. It's not nearly as pronounced as it has been over the last few weeks since Memorial Day. Overall in the state, there's increase largely driven by what's going on in Southern California and the San Joaquin Valley. And then nationally, there's been a very rapid increase since Memorial Day with more than 40,000 cases a day here recently. And I know that Dr. Fauci said that we could easily see 100,000 cases a day. I think maybe in the last couple of days, I don't know, have it right in front of me, but I think we've had 50,000 cases reported in the United States. That is not going in the right direction.
All right. So just the number of cases themselves, that's pretty, alarming. And then you have the trend, which is pretty alarming. But talk about the test positivity rate. The governor says in California, it's up to 6.8%. I know last week it was in the 5s. Why is that concerning?
Yeah, I'm a somewhat of a different mind than the governor about this, but let me just play it out from the state's standpoint right now. So what you have a certain number of people who get tested, and you look at the proportion of those people who have positive tests, who are cases, right? They get reported as cases, and as that proportion goes up, you're concerned that you're starting to see outbreaks. On the other hand, and this is now more the way I think about it, it's also having more positive tests, a greater proportion of positive tests, is also a marker of how efficient we are at doing testing, how we're actually testing large numbers of people from highly impacted neighborhoods rather than, testing people who are worried or who want to travel or who have all sorts of other reasons. So I think of it as a sort of secondary indicator. I know that the governor likes to focus on it. I actually follow, for me personally, I follow the cases even more, understanding that every case represents a certain number of other infections because we're not catching all the infections because of asymptomatic disease.
All right, that's for sure. But I want to ask you a little bit, and this is confusing to a lot of people on Facebook. I'm seeing these questions, and I myself wonder, if the Bay Area numbers are kind of flat, or at least the growth has slowed, why is Newsom rolling back indoor dining and other indoor operations in many Bay Area counties? And then it's just confusing because, you know, Bay Area counties are going on the watch list, coming off the watch list. Just today, you had Santa Clara that was off the watch list, right? But they weren't allowed to have outdoor dining over the weekend. And then Alameda has the most number of cases and hospitalizations, yet they're not on the list. I think a lot of people, Dr. Rutherford, just don't understand what's going on with that.
Yeah, it's worth, if you're really curious, it's worth actually reading the California Department of Public Health's website. There are three things that are of concern. One is increasing infection, which is measured by increasing cases and this percent positivity. Just to give you an idea, in the Bay Area, in the third week of June, we were running about 200 cases a day, and that's what we've been running since March. Okay, in the last 2 weeks, we've gone to 800 cases a day, so that's a big jump. Okay, now it's turned over a little bit; it's starting to go down a little bit, but still, that's a big jump. We actually crossed 1,000 cases a day a few days ago. Meanwhile, our death rate is relatively flat. It hasn't come back down yet, but that's of major concern. So one thing that the governor looks at and the task force looks at is whether the number of cases, the percent positivity. A second thing they look at is how many hospital beds there are. And if we're getting a run on hospital beds, that will trigger these watch lists as well. And the third thing is about supplies and PPE and whether we have the capacity to take care of large numbers of patients. Mm-hmm. So, for instance, one of the things that's happened in the Bay Area is that there's been a massive outbreak in San Quentin. The prison doesn't have the capacity for ICU care, or at least I don't think they do. And those patients have to go someplace. They go into the surrounding hospitals, and they are ICU patients mostly, and so that cuts down on the capacity for care. Now, I would say that statewide there's quite a bit of capacity for care. I think the governor used a number of something like, there's 22% of the hospital beds were being filled up with COVID patients. Mm-hmm. Don't quote me on that, but something like that. And but it's maldistributed. In Imperial County, one of the worst hit counties in California, without a lot of, hospital bed space, they're at 100% of capacity and have in fact sent at least 500 ICU patients out of the county for care, some of whom have ended up here in the Bay Area even. Mm-hmm. Give you an idea of how tight Southern California is. So I think, there are a lot of factors that go into this that they're weighing in trying to understand how fast to open up, how slow to go, and how careful to be.
Well, can we talk about whether you expect to see the numbers go up based on what you saw over 4th of July weekend and the behavior of people and mass gatherings that we saw on social? What do you expect, and then how long before we can actually gauge the impact?
Right. So, clearly Memorial Day was a colossal disaster in the United States, and that cases started to go up in the United States then. It's also true in California. Memorial Day seems to be a kind of a cut point, and the cases started to go up rapidly after that. So are we going to see the same thing from the 4th of July? And I hope you said masked gatherings with a K rather than masked gatherings with an S. But I think we've gotten a lot better about this than we were at Memorial Day. I think the governor prudently removed some things from the list that people could go do, like the beaches, unfortunately, and bars and indoor dining in these kind of highly impacted counties. I think that the message is that, well, I think the health officers are very careful and want to protect the public health. The boards of supervisors might have different agendas and are more interested in economic growth. Clearly, their business to be interested in that as well. Mm-hmm. And it's there's a tension there, and the governor says, "Okay, I'm just gonna decide everybody has to wear masks. If you're on this watch list of now 23 counties, you know, no indoor dining. We're going to scale stuff back. You're going to have to sit tight. Just before I came on the air, there's a new article in the Lancet about a county in England, Leicester County, Leicestershire, where they've had to go back and lock it down again. And that's what you really, 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 really don't want to have happen. And trying to get this sort of blend of activities and exposures right is an attempt to keep us from having to revert back from going back to sheltering in place in certain counties. Imperial County, there actually was a recommendation to go back to shelter in place.
Dr. Rutherford, we're going to have to take a short break on the air, but we'll talk more when we come back about how to safely go back to school for children. Also, everybody's talking about it, the letter that was sent to the WHO about aerosolized transmission and how that might impact the way we social distance now. And I also want to touch on with you which activities you would or would not do right now. So all that when we come back. In the meantime, we'll continue this conversation over on our live streams. All right, Dr. Rutherford, while we're in commercial break, I want to ask you if mask wearing and rolling back the economic activities, if they don't prove to be enough as we watch the numbers, what is the next tool in the governor's tool shed? I mean, could we see the kind of local lockdowns that we saw in China, for example, and elsewhere in Europe, too?
Absolutely. 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 And he's said that consistently. And that's always stage 3 of these plans. I mean, we're kind of messing around at, sort of mid stage 2, but stage 3 is to go back to shelter in place.
Well, not just shelter in place, but we're talking about something even more stringent, right? Where you really, truly are locked in your apartment or house, which we haven't really seen to that degree.
Oh, no, yeah. I don't think you can really do that, but people have to buy food, they have to get drugs, prescriptions, and stuff like that.
Well, in other countries, they have people deliver it to you. If you need to be quarantined.
That too, but that means somebody has to go out to get it to deliver it, so they're out, moving around too. In France, they locked down everything, but this was always very revealing. Grocery stores, drug stores, banks, and tobacco stores. It's like, what?
Yeah.
Yeah, it's like, oh, okay. It's like, what?
Hey,
here's a chance for public health. Sorry.
Oh, no, that's okay. I just wanted to try to get through a few of our Facebook friends' questions before we go back on air.
Yeah.
So let's hit a few of them. Do I need to take a shower when I get back from grocery shopping? Is that going to help?
No, it's not going to help.
Okay. Do I need an N95 mask?
No, not unless you're a healthcare worker working in an ICU or ER.
Okay. Do you believe the lockdown will happen again soon?
It'll happen somewhere. I don't think it's going to happen in the Bay Area, but I think it'll happen somewhere.
Okay. Of course, that's all dependent on what we do, right, individually and collectively. All right, we're coming back on air with Dr. Rutherford.
7, 6, 5, 4, 3.
All right, and we are back with UCSF epidemiologist Dr. George Rutherford. During break, we started to talk about this, which is, Bay Area counties right now have different allowances. But I want to ask you, Dr. Rutherford, which activities you would engage in right now and what you would consider safe. So a quick yes or no, and we'll move on. Indoor dining at a restaurant?
No.
Outdoor dining at a restaurant?
Yeah, if it were laid out correctly.
Indoor gym?
No.
How about outdoor gym? A class?
If you could wipe the equipment down, yes.
Nail salon?
That doesn't come up often for me. Yeah, maybe. I consider that like a barber shop. Yeah.
Okay, so hair salon, you would say yes to that?
I would have to say yes, or my wife would kill me. Yes.
Indoor church gathering?
Tough. I'd have to say you'd have to figure something else out.
Indoor museum?
That shows up on the watch list. I think that if you had the proper kind of social distancing, you might be able to pull it off, whether it's economically feasible to have a few patrons and to have the whole thing open. I don't know.
Outdoor zoo or amusement park?
No to amusement parks and the zoos. Again, it's an issue of social distancing.
Backyard gathering with some friends?
It depends on how many friends, whether they're in your bubble or not, and how they've been conducting themselves.
How about a beach outing?
Tough. I mean, if you're going to go to the beach by yourself and stand and watch the water, fine, unless it's one of the closed beaches. But to use it as an opportunity to get together with 20 of your best friends, not wear masks and screw around, the answer would be no.
All right. How about hiking?
If you're again small group people with whom you've been quarantining, and doing it in a way where there's quite a bit of spacing on the trail, I think that works, and that's what a lot of people have been doing, in fact.
How about athletic workouts with, let's say, you're a school basketball team and it's outdoors and they try to keep the kids apart?
I'd feel a lot better if they wore masks, which I realize is difficult.
Okay. How about staying in a hotel?
I think that's okay. I mean, I could see that. Again, it would depend on what hotel, the standards of hygiene, and who else was in the hotel, and what you were going to do in the hotel. If you're going to go sit in the dining room or the bar all night long, that's probably not a good idea.
Plane ride?
Yeah, I think planes are a lot safer than people give them credit for, especially with the middle seats not being sold. You have to wear masks, and you need to be a little strategic about where you sit. You'd like to be in a place where people aren't going to be passing you all the time.
Well, having said that, though, not all the airlines are abiding by the no middle seat being filled rule. In fact, there are people who question whether that's just cosmetic or actually that is effective at all to keep that middle seat empty. What's your thought on that?
The greater the distance you have, the more effective it's going to be. Is it perfect? No, it's not perfect. I mean, perfect would be having 3 seats to yourself and every other row occupied, but that's not economically viable. You really have to wear masks. There was a guy who came back from China to Toronto with flagrant COVID infection, coughing, sneezing the whole time, but with a mask on, 0 transmissions on the plane to the surrounding passengers and to the flight attendants.
Got it.
So
how about swimming?
Masking is the important thing.
I'm getting 3 questions about outdoor swimming.
Swimming's fine. Swimming's
okay.
fine.
Would it be different if it's indoors?
It depends on what you do when you get out of the pool, right?
So basically,
put your mask on, hang out,
okay.
Get out of there quickly. I think it's fine.
Got it. Keep the mask on. Don't get close to people. That's the general basis for some of the things that you're saying here. I want to move into something that we are seeing a lot on Facebook today, which is 240 health experts sent this letter to the World Health Organization, basically urging it to recognize aerosolized transmission because they're saying, I mean, the micro droplets of infectious coronavirus could be airborne for hours. Is that true? And I guess if it is true, what does that mean for the way we currently social distance?
Well, I mean, if it were just to start with this, there is aerosol. There are aerosols created from coronavirus. They're especially problematic in intensive care units and operating rooms and emergency departments where patients are being intubated and are having things done with their lungs. If you can bring something up from your lungs, you have a greater chance of it aerosolizing. But that's why we use that elaborate personal protective equipment in those situations, because we recognize that aerosols can occur. Can aerosols occur outside of those kinds of settings? Maybe, but not. I mean, these people who were writing the letter, at least my impression is that they were largely sort of people who are interested in kind of sort of air spread and airborne droplet dispersion and sort of the physics of it, rather than having a string of cases that they could say, look at this case was most likely due to aerosol transmission. And what people say is that if there were true aerosol transmission, there'd be 1.4 billion cases in China, not 80,000.
Okay. So the risk is not terribly great, in your opinion, in terms of those micro droplets actually infecting a lot of people, right?
Unless you're working in an ICU. Yeah.
Okay. All right. We're going to take a short break. When we come back, we are going to talk about how to reopen schools safely. You can join us over on our live streams right now to talk about what President Trump said about 99% of COVID cases being totally harmless. We'll be right back. All right, so Dr. Rutherford, the president did say 99% of COVID cases are totally harmless. What does the data show so far? Is that a reasonable interpretation?
No, it's not even close. it's not even close to a reasonable interpretation. You know, for the data from China would say that somewhere in the neighborhood of 40% of people actually develop, you know, recognizable symptoms, and 20% develop severe symptoms, which could lead to hospitalization, and maybe as many as 12% of people actually have to be hospitalized. So it's a much it's a much more virulent disease than I think he gives it credit for. You should talk to his pal Boris Johnson about how he had to go into the ICU with the disease.
Okay. And then there are also a lot of long-term harm that could be done to people too, right? That would not be harmless.
No, no, yeah. I mean, clearly you can completely wreck your lungs. And there was a double lung transplant in Chicago the other day of someone whose lungs had been basically completely scarred from coronavirus infection.
Okay. A couple quick questions from our viewers on Instagram. Do you know the percentage of false negative tests? I have all the symptoms, but the test came back negative for me. What do you say to them?
It's a nasal swab, I assume. The test is highly reliable. It depends where in the timing of illness you get it. If you get it too soon, it'll show up negative. Wait a couple of days. You know, you want to wait at least 3 days after exposure to be tested. Probably more like 7 gives you the lowest odds of missing the test.
All right, we're coming back on air.
5, 4, 3.
And we're back with UCSF epidemiologist Dr. George Rutherford. I want to ask you a couple of questions coming in from our viewers. From Facebook, can you get COVID twice?
We don't know. There have not been case reports. There are case reports of people who have positive nasal swabs, and then they're negative, then they're positive, then they're negative. Those are probably people who have very small sort of residua. A lot of it has to do with what the test picks up. The test is amplifying and looking for any piece of the virus. So if it's all broken up or something, you'll continue to have a positive test. And if it's just a tiny bit, you could kind of have it positive one day, negative the next, positive the next, negative the next. So I don't really consider those as reinfections. We've yet to see a true case of reinfection, but we also are not fully convinced that the immunity that one gets following this infection lasts for very long or is even that effective.
Okay, that's a little scary too. I read a study today that says only 5% of the population has developed antibodies. That was a study out of Spain, and a pretty large one, suggesting that herd immunity that we're striving for is actually unachievable with COVID. What do you know about that one?
I don't know about the specific study, but about 5% of people develop really measurable high levels of neutralizing antibody, which is what we want and what a vaccine's designed to stimulate. And I don't think we're going to get to herd immunity, for which we probably need 60, 70% of people with the antibodies that act, with the right kind of antibodies that actually work. I think that's going to be really tough to achieve without, first of all, without a lot of deaths from this.
Right.
But really, this is a waiting vaccine to get us to that level.
All right. And I mean, even New York, which was hard hit, I think they are at what, 15, 20% herd immunity? Is that what they're saying?
They have about a 15 to 20% prevalence of infection, yeah.
Okay. Hey, I want to move into opening the schools because I have a couple of kids myself, and I guess many parents are wondering, and teachers too, wondering, is that feasible in California, or let's just say the Bay Area, given the trends that we're seeing with the numbers where children would be showing up to their schools in person for their classes?
Yeah, I think it is. But I think you have to differentiate elementary school children from older children. The physiology, the anatomy of the disease that we're talking about, the receptors that the virus locks to, right, are much less numerous and they're much less common in children under 10 than they are, say, in kids at 17 and over, right? It's a sort of straight line gradation. As you get older, you get more of these receptors. So that might explain the observation that there are not a lot of children who get the disease, and there are very few children who actually transmit the disease. Those are data from a number of places, and we've yet to see a real convincing elementary school outbreak. So I think that elementary schools are possibly doable. Now, having said that, because of this Kawasaki-like syndrome, this horrible syndrome that some children get as a probably a late manifestation, we shouldn't be messing around here. And we should be trying to limit transmission as much as possible among children. And so I think what the most school districts are looking at are sort of cohort sizes of around 15 kids in order to get the classrooms to have the kind of the right density of with spreading of desks and things like that, and wearing masks, and somehow working out recess so children from different classes don't mix together. So that means, so if you can only have half the kids in the classroom, that means you're going to have a morning and afternoon, or a half week on, half week off kind of schedule.
Right.
The high schools and middle schools are much more complicated, and you're really going to have to rely largely on masks and social distancing to make that happen, to really achieve some protection there.
What about colleges? Because today Harvard announced that they were actually going to teach all their courses online. However, the kids can live in dorms, not all of them, but I think 40%. So if they're on campus, is the living arrangement, the sharing of cafeteria, for example, bathrooms, does that not pose more of a risk than just sitting in a classroom even? What do you think?
Well, you can only sit in a classroom for so long, and the rest of the day has to be spent somewhere else. I think what most colleges, residential colleges and universities are doing, well, some of them have said we're going to go to all online classes like the California State University system, and others are trying to accommodate some on-campus learning. What I think most of them have chosen to do, is to cut the residential population essentially in half by having everyone have private rooms. So one person per room. So no roommates until we get everybody vaccinated.
Right.
And then there's a whole series of choices that spill out from that.
All right, Dr. Rutherford, we have to take a break on air, but let's finish our conversation over on our live streams. I also want to hear how you think teachers can be best protected. So join us over there if you want to join us now on Facebook Live.
And commercial break.
All right, Dr. Rutherford, I'm hearing from some teachers who, especially at the high school level, for example, let's say they have normally 35 kids in a class. So let's say they do divide the kids up into cohorts and, but if it's one person, one teacher teaching to 2 or 3 separate groups of kids over the course of, I don't know, 1 day or 2 days, isn't that person still exposed? And some teachers say, we're over 50, we need to be protected. How can that be done?
Well, I mean, they wear masks, and you make all the kids wear masks, right? That's the first thing. And the second thing, there's social distancing, right? I realize, so I'm a teacher, I like to walk up and down the aisles, and when people are taking tests and make them nervous, and just pimp them. But you can't do that. You're going to have to maintain some distance. Some school districts have put a plexiglass at the teacher's desk. To give them an extra degree of protection. In some schools in Europe, for instance, the kids wear in Asia, the kids wear face shields as well as masks, or in addition to masks. Teachers might want to do that too. We'll just have to see, but it's this is doable if you use personal protective equipment and maintain social distancing. It's doable.
Okay. I want to ask you about temperature checks and whether you think they are a pretty effective gauge or check on COVID as a symptoms.
They're not bad. They probably about, if you do it temperature and symptom checks, you'll probably catch, I don't know, 60% of cases, something like that. It's hardly foolproof. We do it at UCSF every day before we let anybody into the hospital. I mean, they do it out online. But I think it's hardly foolproof, but it does give you a kind of additional level of protection.
All right. Dr. George Rutherford, thank you so much. Always great catching up with you and hearing about what you're doing. I'll see you again next time. Take good care.
3, 2, 1.
And we're back. Want to thank you so much for joining us on this interactive show, Getting Answers, our Monday edition. We talk with epidemiologist Dr. George Rutherford of UCSF. Now, you know, at one point we went rapid fire asking what he would and wouldn't do. He said outdoor dining, okay, but he wouldn't eat inside restaurants. Backyard gatherings are okay, depending on the friends in your bubble and what they've done. Staying in a hotel is okay too, depending on the standards there, and swimming outdoors is fine. We also talk about what it takes to reopen schools. Hopefully you learned something from our conversation today. We'll be here every day at 3 o'clock on air and on live stream answering your questions. Facebook Live, YouTube Live, abc7news.com, and the ABC7 News app. World News Tonight is next. Take care. All right. Thank you, Facebook friends. Dr. Rutherford, thank you so much. It was great talking with you. Let's keep in touch.
Great to,
Okay, bye-bye.
great to, quote unquote, see you. Take care.
See you
around.
Yep. The only way
Bye.
we can these days.
It's okay. It's okay. Bye-bye. Take care.
Bye-bye.